Good morning friends, welcome back to my YouTube channel Medical Classes by Dr. Srinidhi Kumar Acharya. Please don't forget to subscribe my channel and also please give your valuable comments. You can also visit the playlist. In the playlist I have provided all the topics so far discussed in a very systematic order. So continuing with the fetal growth and development. So in the last class we have seen the first class regarding the development of vascular system in the developing fetus. So today we will see how the arterial system will going to develop. In the vessels we have got arterial system, then venous system, and then fetal circulation. So today we will see the arterial system, how it will going to develop. In the last class I told that arterial system of a fetus can be developed from two parts. One is from the pharyngeal part and another one is from the rest of the body. So today we will see the development of arterial system from the pharyngeal arches. Now, there will be profound proliferation of the mesoderm around the pharynx and develops anterolaterally and grows forward, which is called as pharyngeal arches. Previously, these arches are called as branchial arches, but nowadays it is called as pharyngeal arches. Actually, this looks like the fish gill formation. So there were previously it is called as brachial arches, but now it is called as pharyngeal arches. This particular development of these arches will going to take place bilaterally in the multiple number like 1, 2, 3. Bilaterally this development will take place in the multiple numbers like 1, 2, 3. When it is developing, it has own nerve and arterial branches and the muscle to the tissues related to it. So when it is gone developing, it has got its own nerve. These arches, when they develop, own nerve, own arterial branches, and also muscles which are related to it. Now if you look into this picture, the things are very clear now how these arches are going to develop. And you can see the endoderm, you can see the ectoderm, and then also you can see the mesoderm. And you can see how the changes occur in the mesoderm. In the mesodermal layer, these changes are occurring like artery, nerve, and as well as cartilages. They start here. Okay, these are the different pharyngeal pouches. First pharyngeal pouch, second arch. This is third arch, like this. This is first arch. So this is how you can also see here 1, 2, 3, 4 arches are developing. So from these arches now we have development of the arterial system. Another picture is there. You can also see the same thing here. From the same arches we'll also have the development of different types of nerves also, and also in related to that we also development of the different muscles that we will see later. So now we will only concentrate on the arterial system. Now on the back there will be development of the dorsal artery. In the front there will be development of the ventral arteries. In the development of the heart there will be truncus arteriosus. When the heart is developing, there is development of truncus arteriosus developing, and its most distal part is called as aortic sac. Okay. Its most distal part is called as aortic sac. On the back there is two dorsal aorta developing. Similarly on the back there are two dorsal aorta developing. Heart is present above and near the neck initially, then it becomes thoracic structure. Previously the heart is present near the neck area, okay, and later onwards it becomes a thoracic. So now aortic sac, the blood vessels will connect to the pharyngeal arches and connect to the dorsal aorta, and now it is called as pharyngeal aortic arches. So there are 1 to 6 pharyngeal aortic arches. Fifth one is degenerate and not exist. Fifth one will go into degenerate and it will not exist. So we can count 1 to 5. So development of the arterial system from the pharyngeal arches, how to remember it in an easy way by means of a code word. Remember, first make sexy steps, then call for aortic arch and sleep with the lungs. So this I will say how to remember this. First make, that is first make means first pharyngeal arches. First, make stand for maxillary vessels. So first pharyngeal arches will going to develop the different types of maxillary vessels. Okay, so then sexy steps. So the meaning of the sexy step is second pharyngeal. S stand for second. So second pharyngeal arch, and from that the stapedius vessels will going to develop. Okay, sexy. S for second, another S for steps for stapedius. Then call. Then call means third pharyngeal pouch. From the third pharyngeal pouch, call. C stand for carotid. So carotid vessels will going to develop. Okay, so then call. Then aortic arch. For aortic arch, the fourth pharyngeal arch will come. Okay, aortic arch. You can remember aortic arch. Okay, so fourth pharyngeal pouch we will go development of aorta. Okay, so aorta and also subclavian veins. So fifth arch will go into disintegrate sometime, and last one is sleep with lungs. That means sixth pharyngeal pouch. Sixth pharyngeal pouch. So from that, what will develop is lungs and related vessels. So sleep with the lungs. Sixth means sixth, that is sleep. Yes, yes. Then lungs. Sleep with lungs. So this is how superficially you can remember the different structures which is developing from these pharyngeal arches. First make 6 steps, then call for aortic arch, sleep with lungs. Now development of the arterial system. Now this makes the blood vessels of the lung, pulmonary artery, the last one. So sixth pharyngeal pouch, arch. So that will make the blood vessels related to the lungs, pulmonary artery. The early part, it is made up of truncus arteriosus, and later it divides into right and left pulmonary artery. In the early part, if you see, it is actually made up of truncus arteriosus, and later it divides into right and left pulmonary artery. In the sixth arch, the distal part is right side. Another important thing is in the sixth arch, sixth pharyngeal arch, the distal part in the right side will go into disintegrate. Distal part in the right side will go into disintegrate, while in the left side it continues as left pulmonary artery. Okay, in the left side it will continue as left pulmonary artery and continues as a ductus arteriosus. Continues as ductus arteriosus. When these arches are developing, now there is important thing is vagus. So along with the arches, when they are developing, the vagus nerve is also going down. That is how the vagus nerve reaches the heart. Okay, so otherwise most of the cranial nerves, so they are not coming down from the esophagus, isn't it? Maximum to the esophagus, but the vagus is one nerve which even come up to heart. Okay, so now even up to the intestinal area. So when these arches are developing, the vagus nerve is also going down along with the arches. Actually, this nerve is connected with the larynx. Originally, heart is developing from the neck area. I told. Originally, heart is developing from the neck area, and this nerve is present up to sixth pharyngeal pouch. Nerve is present up to sixth pharyngeal pouch. Now, as the heart descends down with the development, larynx remains there only, but nerve is not just pulled downwards. This nerve is just pulled downwards. So, but nerve remain connected with the larynx. Nerve didn't disconnect with the larynx. Nerve is remain connected with the larynx. But as the heart comes down, this nerve also comes down. Vagus nerve also come down with the heart. So now the nerve has to create a reverse course or a recurrent course with the larynx. Therefore, that branch is called as recurrent laryngeal nerve. Okay, so this nerve is called as a recurrent laryngeal nerve. So this nerve goes around the ductus arteriosus, and after the birth it is converted into ligamentum arteriosum. In the adult, it hook around it. Now that's the reason any pressure effects on the superior mediastinum will also cause some of the problem related to voice. Okay, it presses the recurrent laryngeal nerve. So that is because of the reverse course of this particular nerve. On the right side from the sixth pharyngeal pouch, there will be disintegration of the fifth arch, and so the recurrent laryngeal nerve hooks around the fourth arch, and now it is placed at the upper side of the right side. Now let us see some of the clinical conditions related to development of this arterial system by the pharyngeal pouches. Double aorta. Usually the dorsal aorta, which runs as two tubes will fuse in the below to form the descending aorta, T4 level. At the level of the T4, the dorsal aortas, which runs as two tubes, will fuse to form a descending aorta below at the level of the T4. All the structure in the later part remodifies, and initially between these two dorsal aorta are around the respiratory and digestive system. Now, all the structures in the later part, what actually happens is they get remodifies, and initially between the two dorsal aorta are around the respiratory and digestive system. Sometime there will be a maldevelopment. Sometime there will be a maldevelopment that person will have two aorta coming from the heart due to failure of fusion of these dorsal aortas. I hope you understand. Dorsal aorta is coming down from backside, and usually it is two, but at the level of the T4 it will go into fuse and it forms a single aorta called as a descending aorta. But sometimes what happens is this fusion will not take place, and this leads to the formation of the double aorta. Okay, so there will be dysphagia and dysphagia to the child. This will cause the dysphagia to the child. Sometimes the distal to the origin of the left subclavian artery. We are looking at some of the clinical conditions. One is over, that is a double aorta. Another is coarctation of a aorta. Coarctation of a aorta. Sometimes distal to the origin of the left subclavian artery, the aorta become narrow just before or proximal to the ductus arteriosus or after the ductus arteriosus. This particular narrowness may be proximal or may be distal. Sometimes some believe that this is because of the loose muscle layer of the ductus arteriosus, which expand or extend out and produce this particular constriction. So when ductus arteriosus closes due to high oxygen after birth, then these muscles also constrict and close, producing a narrow constriction, and this will be followed by constriction of the intima layer of the artery also. So this narrowing may be before ductus arteriosus, and then it is called as preductal coarctation, and if it is after ductus arteriosus, then it is called as postductal coarctation. So this may occur in many conditions associated with the cardiac anomalies, and also in Turner syndrome. Turner syndrome, very important. This is one of the most common cardiac anomaly. Turner syndrome, and this is more common. Okay, so this is also seen in Turner syndrome, and this coarctation of aorta is also more common in boys compared to females. And if there is narrowing, blood cannot go down to the descending aorta, then there are two possibilities. If there is preductal coarctation, these small points are very important. If there is preductal coarctation before ductus arteriosus, then what happens? From the left ventricle, the blood will come to the aorta, but because there is an obstruction, so it cannot go further due to obstruction. Because of obstruction, it will not. So left ventricle, the blood will come to the aorta. From the aorta, it is not going forward because there is a constriction. So ductus arteriosus may remain open, and blood can shunt from it to pulmonary artery due to raised back pressure in the ventricles. This is one point. Second, if the obstruction is after distal, okay, postductal, ducts के बाद है, postductal, then the pressure is high and ductus arteriosus will closes, but will not flow down to the descending aorta. So there will be development of collaterals like internal thoracic artery, which connects with the intercostal arteries. From the intercostal artery, in reverse direction, the blood reaches the descending aorta. So blood also has the collaterals with the periscapular arteries also. High blood pressure in the upper limb and low blood pressure in the lower limbs. Now this is another possibility. So high blood pressure, so because of all these things, what happens? Blood is not coming down at all. Therefore, there will be low blood pressure in the lower limb. Femoral artery, if you take the blood pressure in the femoral area, the blood pressure is very low. But whereas in the brachial area, if you take the brachial artery pressure, so the pressure is more. High blood pressure in the upper limb and low blood pressure in the lower limbs. This is the result. So always palpate the radial and as well as femoral artery at a time. Okay, so femoral pulse and radial pulse should be seen at a time. So if the coarctation of aorta is there, then pulse will be felt after a small delay. This is called as radiofemoral delay. This is called as radiofemoral delay. High blood flow in the intercostal arteries may lead to injury to the ribs. Okay, so this leads to different types of notches in the ribs, rib notches. That is because of the high blood flow in the intercostal arteries. Similarly, due to high blood flow in the collaterals, there will be bruits or bruits in the upper limb arteries. Upper limb arteries. So these parents have higher chances of stroke due to reduced blood supply to the brain. Because of constriction, the blood supply will be reduced. So what is the treatment? Treatment that you have to go for surgical correction. Now another is now development of the arteries in the rest of the body. Now we have so far seen the development of the arteries from the pharyngeal arches, different arteries, how they will going to develop, and now then further they will going to proliferate. Now this is the initial part. Okay. Now another part is development of arteries from the rest of the body. As we know, two dorsal aorta will fuse and there will be formation of the single aorta, I told. If this fusion will not take place, means it leads to double aorta. And there will be many branches will come out of it. From this dorsal aorta now, many branches will come out of it, that is called as angiogenesis. There will be posterior lateral, medial and ventral branches which is coming out of it. Now these are the different branches of descending aorta. We have got celiac trunk, supramesenteric artery in the later part. Okay, so lateral branches, they supply to the kidney, renal arteries, suprarenal arteries. Okay, so renal, suprarenal, they lead to lateral branches. So basically they divide into medial, ventral and ventral branches which is coming out of it. The lateral branches usually give these renal arteries and suprarenal arteries. The medial branches, they usually give rise to the celiac trunk, colic trunk, and then superior mesenteric, inframesenteric arteries, etc. Now ventral branches, okay, ventral branches, another set of the arteries that's called as ventral branches. So they are going to the yolk sac and they are called as vitelline arteries. The ventral branches which is coming out now, so they now go to the yolk sac, connect with the yolk sac, and they are called as vitelline arteries. So what are these arteries? Celiac arteries. Celiac artery will basically supply to the foregut area, then superior mesenteric artery that will supply to the midgut area, and inferior mesenteric arteries that will supply to hindgut area. Okay, the ventral branches at the lower level, if you look at the lower level, the ventral branches, so there will be two arteries, they move forward in the front of the urinary bladder and they cross the umbilical cord. Ventral branches at the lower level, there will be two important arteries, so they move forwards in front of the urinary bladder of the fetus and then they cross the umbilical cord and they will not go to the yolk sac. As the development goes on, these two umbilical arteries come down and become integrated with the internal iliac arteries. Until the baby has not born, these arteries are called as umbilical arteries and it will go to the umbilical cord. In adults, these umbilical arteries will make, that means after birth, these umbilical arteries, they will go into disintegrate and then they are called as a median umbilical ligament, which is get attached to the apex of the bladder, which hold the bladder up. So remaining portion of the internal iliac artery and the vesical artery, so their fibrosed portion becomes median umbilical ligament. So this is how the umbilical arteries are formed. Okay, actually basically from the ventral branches, the lowermost part of the ventral branches, so we will have two arteries, so which forms the umbilical arteries, and they will not go to the yolk sac. Now there will be initially development of three important venous system which are developing, and this venous system that we will go to discuss in the next class. Thank you very much for patience listening, and please don't forget to subscribe my channel, and also please give your valuable comments. Thank you very much.